Welcome back to Rohrich Knows Podcast. Hi, this is DrRodRohrich. I'm a board-certified plastic surgeon in Dallas, Texas. Today, let's talk about a very common filler that we do in the office. It's called a lip filler. And one of the most amazing things I see about lips is that they're so often poorly done. I just see a beautiful woman and they come in and it just sticks out like a sore thumb because it's just been overdone. So let me just share with you some of my thoughts and experience about doing lip fillers and the things to do and not do. And I call this the 5-point lip filler. You know, this is what you don't want to do and end up with. This just, and it's not totally reversible. That's a myth behind hyaluronic acid fillers because they become impregnated in your skin and your dermis and you can't remove them. This is not normal. And you know, maybe it's somebody's preference, but this is not a result that I want. And honestly, I will only do what I think looks good. If patients want to have lips done or overdone, I don't do them. I just don't, that's not in my aesthetic. So one thing we have to understand is that as we get older, our lips age too. You know, they get longer, they get thinner, and the lip filler helps the thin lip. But if the lip gets longer, then of course you need a lip lift, which is a whole different topic. But basically, it becomes blunted. And so when you look at that and you look at what a youthful lip should look like, it really should be where the upper lip is about 75% the volume of the lower lip, okay? The lower lip should never be, the upper lip should never be bigger than the lower lip, except for, you know, in giraffes and orangutans, okay? And you should only show 1 or 3 millimeters of incisor show on repose. And that's what should look normal, like this patient. That's a normal repose. And I think that's what you want. And when you see patients like this that have that overdone lip, that shelf look, that is not a normal good look. Now, some patients may like that, but that's not my aesthetic. And if patients want that, I don't do it. And I see that not infrequently. And of course, this you can fix by melting it with hyaluronic acid, hyaluronidase, but it's not a look that I like. This is that overdone vermilion cutaneous border look. It's not a look I like. You know, and you take somebody like this and then you do this to them, that's almost irreparable. And it's just not something that is a good aesthetic. So I just don't do that. Now, if you have somebody like this that just wants some accentuation of their beautiful lip, they have some aging, but you do that, look, now their lower lip is, you know, really more robust. You know, it's actually a little bigger than the upper lip, but there's well-defined lines. That's what you want of the vermilion cutaneous border. And these are all the things that are very important. Your philtral ridges, your commissures, the amount of upper lip vermilion, lower lip vermilion. These are all things that when I look at a patient, these are the things that I imprint, you know, from my brain onto their lips. And there's all kinds of lip injection schemes, and many of them are very, very complicated. But I've tried to set out when I teach it that it's got to be simple to do and follow these axioms. Less is more. The lower lip is 1.6 the volume of the upper lip, okay? And you volumize the commissures first. These are the things on the side of the mouth. If you don't do that, they look weird. So those are some of the axioms. So what do I look at? I look at the commissures. I look at the upper lip vermilion cutaneous border. That's what the area that you want to fill. You look at number 3, the philtral column, and you fill that in gently. And then number 4, these Cupid's bow, just below the Cupid's bow, that pillow. And number 5 is the lower lip pillow that you want to fill in. That gives you an aesthetic lip. That's the 5-point lip. The 5-point lip filler volumizes the commissures, gets the vermilion cutaneous border laterally, but not overcorrecting it, does the philtral column, does the upper lip Cupid's bow tubercles, and then the lower lip tubercles. And those are the key parameters. And when you do that, you work from outer to upper to inner, and you can soften that. So you can really get the commissures, do the vermilion cutaneous border, and you can soften it. And this is all done with a minimal amount of volumizing. I don't use more than a cc of a volumizing filler, and I like to use a hyaluronic acid filler that does that. And I think that's really important. So when I'm looking at doing a lip filler, I really talk a lot about these 5 things. So these are just some examples of patients that have had, a CC, a filler or less with using this. And again, here's a 26-year-old that had similar shaping and refilling with a 5-point technique. Here's another one, that a 19-year-old that had another one that had a similar one. She also had Botox to the lower lip muscles that help to elevate the sides of her lips and gives you shaping and contouring. And similarly, another one that had desired central fuller upper lips, and that's where Juvederm Ultra Plus was placed in the central upper and lower lips in the corners of the mouth. And that's really what you want. And so know before you go, find someone that has expertise and experience in doing this and does not over-volumize and overfill. You can always do more. Remember, less is more. Give me your comments, give me your thoughts, and helping you become a better and more informed you.